Today, we've got a long distance communication going because we're speaking to what has become a friend of mine, I think, over the past few weeks, all the way from Bangalore in India. Now, as a brief introduction to the purpose behind this hopefully series of conversations that we're going to be having is that Dr. Gaurang Ramesh he's a medical doctor, he's a surgeon in gastroenterology at Bangalore Hospital, but he has what I consider a very, very interesting understanding of medicine and health, which goes beyond the sort of traditional medical doctor's view on it, I think. And considering the changes that are happening, particularly in these days with the COVID pandemic and the fairly severe reactions towards it, I think we've come to think about health again. And these kind of very dramatic occurrences, I think, are great opportunities to revise the paradigm that was prevalent before, and out of which hopefully we can build something better. And Dr. Ramesh has some fascinating way of looking at health and medicine, which perhaps stems a little bit from his Indian origins and Ayurveda. We'll ask him, but it's a much more holistic approach. And with all that, welcome to the program, Gaurang. I hope I can call you by your first name. We know each other pretty well by now. Welcome to Free Observer.
Thank you so much, Casper, for giving me the opportunity to join you. I think you are taking a very noble initiative at a time where the whole world is confused with the information, what they're receiving. The journalism also has been very confusing. People don't know whom to believe and what to trust. Everybody has a lot of information, and you have been going in the pursuit of finding the truth and making it available to the masses. And thank you so much for giving me the opportunity to be a part of this noble initiative.
Wow, thank you. I mean, I think we need to recruit you as our marketing agents. That's very kind of you. I mean, that's obviously our kind of ambition, is to look at things with greater nuance and from a different perspective. Also to get a better understanding, because nothing is singular. Life is much more complex than that. So maybe I just explain how I got to know about you. I mean, I've been following you for a while without you knowing, basically on social media, which shows that yes, technology can be a challenge in terms of the invasion into our lives, but it can also bring us together. And it's one way of obviously communicating all this knowledge we're about to discover now. But you've been posting fairly regularly about your views on especially diet-related things. So why don't we start with you giving us your macro perspective on how you look at health and medicine and the human body?
Yeah. Well, as a doctor, in the training, we've always learned only to look at the disease, the illness only, and treat the illness. But we never concentrate on getting the physiology back to completely normal state. Once the disease is okay, we are done with the treatment. We don't bother about the patient. So, but what is happening today is we are moving towards an epidemic of chronic diseases. So the top 5 reasons of death today are preventable chronic diseases, which can probably be reversed completely if we really focus on the diet and the lifestyle changes.
Interesting.
But traditionally, our medical training has always taught us to treat only the disease. So we only have been looking at the symptoms and the pathology. For example, when we look at diabetes, we call and diagnose the patient as diabetes when the blood sugar levels are high. And we only focus on getting the blood sugar levels low. So what we are doing with the medicines are we are pushing all the sugar from the bloodstream into the cells, but we don't really focus on what's happening in the cell. So when we go into the physiology or the biochemistry and understand chronic diseases and focus on reversing chronic diseases, I think it comes down to just four simple things: diet, exercise, sleep, and mental health. So I think those four things are the pillars of our health and well-being now. And I want to focus on those four pillars more than just treating the diseases.
Yeah, I remember those four last time we spoke. They've become my sort of four, I don't know, not dogmas, but guiding principles, as you say. 1, diet; 2, sleep; 3, movement and activity; and then 4, the mind and the role of the mind. We're going to explore all these, but your approach, which is what I find so interesting, I mean, you called it functional medicine, which has a multidisciplinary approach, and obviously all those four are evidence of this multidisciplinary nature or holistic nature of it. So tell us a little bit. I mean, you've spoken specifically now, and we'll come into that about diabetes, which is a significant problem around the world. And being Danish, you know, we're very familiar with it because of the pharmaceutical companies that we have, like Novo Nordisk, that produces treatments against it. But tell us the story of how you made the discovery of the impact, your personal story, that is, I'm thinking of your grandfather now, of the impact that such a holistic approach can have. Because one thing is that we all know that we ought to balance these four things in our lives. But I think it's very powerful when we hear actual cases that illustrate just how profound these effects can be.
Yeah. My grandfather was a professor of medicine himself. So when I
very distinguished family.
When I finished my surgical residency and got back home, he was in a progressive stage of Alzheimer's, advanced stage of Alzheimer's. And being a doctor himself, we had access to the best neurologists in the city. And all of them had given up on him. They said, no, this is a progressive disease, which nothing can be done now. He just has to live with it. So that's when I thought I wanted to go a little more deeper, and I came across a book called End of Alzheimer's by Dale Bredesen.
So Dale Bredesen, The End of Alzheimer's.
Yeah. So he is a neurobiologist who has spent about 25 to 30 years on just Alzheimer's research. He's based in America, in Chicago. Yeah. So he has developed an extensive protocol on diagnosing and also treating Alzheimer's, and he's had the highest success rate of reversing cognitive decline. Being in India, I didn't have access to advanced diagnostics, the genetic testing and advanced biochemical testing. So, but I just followed his protocols, dietary changes and lifestyle changes. And within 6 months, my grandfather, who was completely bedridden, he was dependent on everybody. He was not able to swallow solid. He was only having liquids. He progressed to a state where he started talking, he started responding. He was able to swallow solid food. He could move, and he could eat by himself also. So everybody at home was shocked to see the kind of progress he made. And,
I can imagine, yeah.
So that's when I realized that we are really missing the fundamental aspects of health in medicine. And that's when I realized the potential of food also. And I wanted to dive a little deeper, and I got introduced to functional medicine. So functional medicine was...
But just before we get on to that whole concept and practice of functional medicine, first of all, when was that book published?
2018.
2018. So it's a relatively new book. And what were the protocols that, I mean, you had some limitations, as most people do, in terms of access to certain medical equipment, but what were the principal protocols that you implemented?
His basic principle was to get into the root cause.
Yeah.
So he mainly says, if you have to break it down into very basic stuff, he says that Alzheimer's can be because of insulin resistance. So just like diabetes, which we call the type 2 diabetes, the recent concept...
You froze. Unfortunately, everything froze on your side. Okay, so that's from 2018. So it's a relatively new book. But can you just tell us about what were the protocols or the principles that he outlined?
Yeah, he mainly says that we have to go into the root cause of Alzheimer's. The root cause can be because of multiple things. First, it could be insulin resistance in the brain. So the present concept is that just like in type 2 diabetes, our body develops insulin resistance. Alzheimer's or cognitive decline is considered to be type 3 diabetes, where there is insulin resistance in the brain. And this is also mainly because of our diet and food, excess carbohydrates in the diet. And the second reason can be because of chronic inflammation in the brain, because of a low-grade infection, which has not been treated completely. My grandfather had a chronic otitis media, in the ear infection, which he neglected for a while, and he always had some problem with the ear. And it could be low nutrients in the diet, nutrient insufficiency, nutrient deficiency, which can cause Alzheimer's. It could be toxins. We are continuously exposed to toxins from the environment, or it can be toxins which are implanted into our body. For example, in the tooth, when you undergo root canal, earlier they used to have mercury amalgam inserted into the root canal for the root canal treatment. So that can get into the blood over a long time and cause Alzheimer's.
Yeah, it's funny. Some of the posts that I've read of yours, they talk about the bacterial health of your throat, and there you talk about fluor as well, and some of these things, how they can cause it. But that comes later on. But so he mentions obviously diet, both in terms of toxins we're exposed to.
What he says is we need to actually find out what might be the reason for the person's Alzheimer's. So you have to test for the toxic level in the body. You have to check if there's any chronic infections, and you'll have to modify his diet and reduce the carbohydrate intake, supplement him with all, not just some nutrients which we know, like vitamins and minerals, but also supplement some fairly new supplements which power up the mitochondria.
Yeah, we talked about those. We'll definitely we'll get into those, but you read this book, and I want to return back to your grandfather, and then the patient that you have before we delve into these specifics, because none of these things that you've just mentioned, I mean, none of these kinds of, let's call it holistic ways of analyzing a patient is currently done, right? I mean, none of those factors are taken into account when a patient comes in with a chronic disease.
That's true. It takes about, when we really want to probe into the root cause, it takes about 1.5 hours or 2 hours for the initial consultation, which no doctor or health professional has the time. And it's not exactly that the health professional doesn't have the time, but the basic structure of our healthcare system has always been to spend 10-15 minutes with a patient, come to a diagnosis, prescribe a medication, and be done with it.
Yeah, so
that is
really...
the reason why we don't have the time or we don't have the perspective to go into the root cause.
Right. So this is a structural issue, and as we'll touch on later on, of course, the way we approach it in terms of single factor treatments is very much related, of course, to the economics of the pharmaceutical industry and so on. So you had these remarkable results following these very simple protocols, which sound self-evident to most people, and yet they are not implemented. But that's really because you took charge and you did your own research, but you didn't do anything that anyone else can't, in principle, do themselves. I mean, you changed diet, you measured toxicity levels, and what else? And you added some supplements that enhance the receptivity for the nutrients.
Yeah, some just very few supplements, completely modified his diet, and also started physiotherapy. Although he had little resistance. Initially, it was a little forcefully introduced physiotherapy, but then he tried it now.
And it's your belief that all those things really added up to a wholesome. And I mean, you told us the results, and I assume your grandfather is in continuous progression from where he was.
Yeah, at least he. At the stage he was in, even if I'm not able to get him back to normal, make him drive a car or something like that, at least his quality of life has significantly improved.
Yeah.
And that's more than enough, I think.
Yeah. Yeah. It's just a wonderful story. I mean, I'm touched, which is why I wanted you to tell it. But you also had a patient, just to finish on the sort of particular examples. You also had a very obese patient, again, one of these typical, almost lifestyle-derived chronic illnesses that so many people suffer from today. And tell us about that one.
Ever since I started this journey, I think every patient has been like a miracle, because I just do simple stuff like remove bad stuff, introduce little good stuff, and I'm done. And the magic just happens. Brilliant. The body takes care of everything. So to give you an illustration, for example, you have diabetes, which is also considered, the traditional medicine looks at diabetes as a progressive disease. So when a person is diagnosed with diabetes, we always start him with one drug. Then over a few years, it progresses to 2 drugs, 3 drugs, and then insulin. And then throughout the life, we tell him that you need to be on medication. And when we look at the statistics, because of the medication, the complications of vascular complications might have slightly reduced, but then we don't improve the mortality or the morbidity of the patient at all.
Just explain to us the vascular condition. What does that mean?
Yeah. So when there is excess of glucose in the blood.
Right.
It can cause problem everywhere. In the kidneys, it can cause nephropathy. In the eyes, it can cause blurring of vision. It can cause retinopathy. In the peripheral vascular system, it can cause neuropathy. It can cause pain and decreased sensation on the limbs.
And glucose is not just sugar. It can be an excess of carbohydrates, right?
Yeah, it's mainly what we see is the glucose is how the body metabolizes carbohydrates and reaches all over the body. So we mainly look at the glucose when we
So
test.
what did you do with this? Just explain the situation, because he was severely
right. When a patient comes to me, they are at end stage. I mean, they are also at a progressive stage of diabetes.
Mm-hmm.
They to give you an example of one patient, he had grade 1 kidney diseases because of diabetes. He had retinopathy. He had blurring of vision. He also had lost 2 of his toes because of some non-healing ulcers he developed due to diabetic complication.
Yeah, that's very typical, right? I mean, that occurs pretty frequently.
Yeah, the infection really aggravates in diabetes, and they end up, sometimes we just cannot control the infection. We have to amputate to save the rest of the limb.
Yeah.
So that way he has lost 2 toes, and also he had he was on insulin for about 25 years. So the only small changes I made was radically change his diet to have more vegetables and healthy fats, and reduce the amount of refined carbohydrates, processed food. And within about, he was on 14 units of insulin. And within 1 month, it came down to about 12 to 16 units of insulin. And incorporating a little bit of exercises like yoga and a little bit of cardio, in 2 months he was out of insulin, and he was
hold on. Let's just pause there for a minute. So for 20 plus years, this person has been on an increasing dosage of medicines of various kinds, insulin, of course, being the primary one. And in 2 months, from doing perfectly normal things, just because you look at it differently, this guy is now off the medicine. He has suffered immeasurably, kidney failure. His toes are gone, and more amputations perhaps are occurring. He's severely deprived of any quality of life because of his immobility and so on and so forth. And so in 2 months, where are we now? He's off the medicines, and then what?
And when you look at his cost also, he used to spend about $100 a month for his medications. Right. Now he spends about $10 a month for just he was also a cardiac patient, so I have not got him out of cardiac medication. So just a little bit of medication is still there. Right. So the whole point of the problem is when we start them on medication, we don't want the patient. I'm talking about the traditional allopathic view. When when the patient is on medication, we don't want the blood sugars to fluctuate, go too high or too low. So we tell them to have small meals, have multiple meals throughout the day, maintain the blood sugar constantly. That is with medication. But we are not addressing the fact that the problem of is because of excessive carbohydrates, excessive insulin stimulation. And for that, we have to incorporate at least a little bit of fasting and give the body time to remove the excess glucose which has got built up in the cells. So this change in thinking has to happen in terms of looking not just at the symptoms, but at the root cause, at the biochemistry of this disease.
This reminds me of when I was at university in the late 90s in the UK, and Tony Blair was elected with a whole new Labour paradigm. And the catchphrase was always the root causes of the problems. And we always talk about the root causes when we deal with social issues and economic issues. So particularly in the relation to equality, for years and years and years, this debate has been raging. We don't want to just send checks to these people. We want to alleviate it in the first place. And I see the parallel, of course, now to health and medicine. But so just very briefly, where is that patient now? I've become fascinated by these guys. Where is he today?
He is at a very prominent position in his career. So he's enjoying his, he's got more energy, he's able to work for longer hours. He doesn't have the, fatigue which he used to get in the afternoon. So he's really, it's just changed his life now. So I think this is more satisfying for me than doing surgeries.
Yeah,
so that's why I have.
I can well believe that. But touching on surgeries, because I remember, I wasn't aware of this, and now we want to get to kind of how we got to this, which is, in my view, insane situation, and have created a multi-billion, hundreds of $billion industry around it to basically ensure that it stays, maybe not ensure that it stays the same way, but it helps reinforce the structure. But you were telling me about a treatment that's applied, which is a surgery of the stomach for severely obese people, so people of 150 kilos and above, where they surgically go and shrink the stomach. And this is what alerted you to some of these things, because of the consequences after this. Just briefly explain that.
Yeah. So when my father is a surgeon, actually. So when I was in med school, he was doing something called bariatric surgery. Yeah. So this surgery is done for morbidly obese people. We either cut the stomach about most of the stomach out, so that we limit the capacity of the stomach, so the person can't eat enough, so gradually the person will lose weight, or we bypass the stomach and some part of the intestine and connect the upper part of the stomach directly to the lower end of the intestines, so that there's not enough absorption of food happening, and the person gradually loses weight. But what happened is
fat. Eventually.
Yeah, they start burning fat. Yeah. So what happened after they started doing this surgery is patients also started experiencing metabolic changes which could not be explained. The next day after surgery, the diabetes was gone. The person who was on 90 units of insulin did not require any insulin on the next day. The patient who had arthritis, knee problems, the pain was gone after bariatric surgery. So when I came across this in my med school, I got fascinated that a surgery can, cure metabolic diseases, chronic diseases. So that's when I got into surgery. But over the past 10 years now, we have realized that it's not just the hormones which are playing, but the microbiome of the intestines, that is the bacteria in our intestines, is radically shifting after the bariatric surgery. And that may also be responsible for all the metabolic changes which is happening in the body. So now I realize that when we are able to, treat the microbiome, handle the microbiome, and we don't need the surgery. We can, radically change, keep the person. There's something called yo-yo phenomenon happens when a person loses weight very rapidly, about 30-40 kgs in a period of time, then they get back to the original weight. But when you really do a holistic approach, address the microbiome, address the mental, train the person to form good habits, change the perspective of the person to not have addictions, then you can really sustain the change of a person. And we don't really need surgeries now, at
No,
least
because
for these problems.
that's obviously
Yeah,
what we want to get to. We want to obviously
yeah.
avoid the surgery to the extent that it's possible. But what do you mean by this microbiome, and how does that work? Is that a food intake or supplement or?
Yeah, so we have what so basically when we look at the intestines, we have about 1 to 1.5 kg worth of bacteria, right from our upper GI to up to the colon, I mean the anus, and the most part of it is in the colon. So this bacteria is in the intestines is called the microbiome.
Gotcha.
It doesn't have to be just the bacteria. It can be some parasites or fungi or anything which is living in our body and helping us in our normal function of our body. So what it does, we thought was, uh, over the last 10 years, the understanding of our microbiome has radically changed and shifted the paradigm. So we have realized that it is that if you look at the genetic makeup uh, of your body, we have about 20,000 genes, but in our microbiome itself, we have more, about 20 to 30 times more of genetic material than what our own genome has.
Yeah.
And
foreign bodies, effectively.
Yeah, foreign.
Yeah.
So, and when we look at our immune system also, 2/3 of the immune cells are in the gut. So after
Hold on, nobody knows this. Well, I mean, I'm sure lots of people do, but I didn't, and I think a lot of people I know didn't know this. So,
yeah.
2/3 of all the stuff that we essentially need for our immune system is actually in our intestines or our gut. I mean, we're going to talk about the gut brain in a short while, but I mean, this is fascinating. So there are two things here. First of all, we need to understand and get comfortable with the fact that bacteria is good for us. Now, in these COVID days, I think that's a very important message, that you want to be careful that you are not, insulating yourself from healthy bacteria. And we have to stop thinking about it necessarily as a threat or a danger. In fact, it is, 75% of our defense system derives from these alien bodies, which are almost like antigens, I suppose, in some sense. But anyway, sorry. So carry on.
So what I meant was the 75% of the immune cells is in the lymphatic system of the gut.
Right.
So that's in the blood vessels of the gut. So now when we really, so gut is exposed to foreign material much more than any other organ is exposed to. So, sorry,
that's the live TV. That's how it is. That's okay.
Can we just stop for 5 minutes?
Yeah, sure.
I just.
Okay, so the gut. I'm sitting here looking at my notes that I've been taking whilst we're speaking. So forgive me for having to look down a little bit, but so the whole gut system obviously plays a vital part, and that's perhaps one of the big findings that you've done. So, and we briefly touched on the kind of exchange or the transferability of information between the outer world and these foreign bodies that are the bacteria in our gut or colon. That obviously plays a very important part, as we've seen in the two cases that you mentioned. Now we get this obviously from the skin, where we're exposed to the outer world, and then through the mouth. So especially, I suppose, the food that we eat. So just quickly tell us about how that whole process works from your point of view, and how it's important to maintain that cycle of events, but also what type of new supplements, rather than just vitamins and minerals and probiotics. But I remember you mentioned some other nutrients that play a part in the dynamic and the absorption and absorbability of all these nutrients.
Yeah. So to tell you about where the nutrients are heading now, our understanding till now has been in the macronutrients, which are the carbohydrates, lipids, and proteins, and micronutrients, which we look at minerals and vitamins mainly. But now we've realized that there are certain components in the plants which are called phytonutrients. So these phytonutrients not only, improve the microbiome health, provide nutrition to the microbiome, and increase the good bacterial health, but also some of the enzyme, it will also help us in the optimal function of our enzymes also in the body. So for example, we have beta carotene in the yellow and orange vegetables. Right. We have something called sulforaphane in are cruciferous vegetables like the cabbage, cauliflower, and
so these are naturally occurring things.
Yeah, these are all naturally occurring. So it really, when we look at how our ancestors ate, we have evolved over 1 million years, and over the last 150 years, our diet has radically changed. We've had this industrial revolution and the agricultural revolution, which has completely changed which we have concentrated on grains so much that over the past couple of 1,000 years, our ancestors never focused so much on grains. So if we look at our genetic change, what we have gone through, most of our time we have spent in the evolution as hunter-gatherers. If you look at the human evolution. So as hunter-gatherers, we ate a whole variety of fruits and vegetables and nuts and everything which was available. And we had a lot of variety. So when we do the same principle now, we are able to see that there's a lot of changes in the entire human physiology and biochemistry. When we have a huge, all kinds of colors in our diet. In 1 week, if you have all the colors available in terms of vegetables, and also have variety of vegetables, not just stick to carrot or cucumber and beans or something, have a staple diet, have a variety like how it is in the Mediterranean diet.
So it's really like a painting, make sure you get the whole palette of colors and shapes and sizes, because that's really how you get the balance and the variety that's necessary, right? Whereas it's been very singular, as you say, it's been very grain based, and we know that many of the diabetes issues stem from, as you said, excessive carb intake, which translates into sugar. I mean, I think more and more people are becoming aware of this. Corn in the US is a big factor. But so again, we have all this readily available to us, and it's industrial, societal, economic changes that have brought us away from it, and we've built up a whole industry that obviously has served an enormous amount of good. I mean, you mentioned the Industrial Revolution, so if we put this in a historical context, then I remember you were telling me last time I think we spoke, through the 18th and 19th century, obviously we had the primary challenge was infectious diseases, the pneumonia, the plague, etc. and it was molecules, single molecules that represented the challenge. And now we are challenged or threatened by other types of diseases, the chronic ones. So the most prevalent and dominant ones being dementia, lung and heart vascular, Alzheimer's, which we talked about also in the case of your grandfather. And these, incidentally, are also the ones in these COVID times who are the most exposed people. And because these diseases themselves are multifactorial in their causes, so too, by natural extension, should be the treatments. And that's your whole thesis, which I find interesting. And then tell us how much at medical school, how much time do you spend on these sort of things, which we know play a major part, but how widely is this taught?
In our first year of medicine in med school, we have about maybe 8 to 10 hours of nutrition. And then we learn a little bit about deficiencies and how to manage that in preventive medicine and general medicine.
Right.
But because we go into the depth of the pathology and diseases, we doctors assume that we know a lot about nutrition. But the nutrition science has evolved so much over the past, at least last 10, 15 years, that we can really, every person is not the same. Like how you were mentioning, if you, for how we have been evolving in medicine by allopathy especially, is by molecules and doing trials in terms of single drugs. So we have always been thinking for a particular disease, we need a particular drug.
Yeah.
So these symptoms, you will, help us diagnose this particular disease. And for this disease, we need to give this molecule. So when we try to, statistically look at evidence, it's easy to produce evidence for a pharmacological agent. But when it comes to this holistic approach to medicine, it's very difficult to say that just the adding spinach to your diet is causing this change in your body. It's not so as simple as adding a molecule. It is the entire spectrum of changes. You need
to, of course, with the way the whole research industry and way of evidencing things is exactly that. It's evidence-based, and of course things should be evidence-based, but it means it becomes very restrictive because it's hard to measure in very simplistic terms a whole range of different factors if you want to come to a conclusion. Whereas if you just have one single input and it has an instant effect on the symptoms, then and that's basically what has driven the industry. And so those are the treatments that are considered medicinal.
Yeah, if you look at the funding of the research also, it's all the research, 90% of the research done today is funded by pharmaceutical industries, at least industries which make profit. So, nutrition, it's hard to make profit in nutrition. So nobody is interested in nutritional research and nobody funds them. Our medical conferences are funded by pharmaceutical industries. How are we take decisions, form protocols, all that is funded by pharmaceuticals and driven by pharmaceutical industry. So that is why we are, our perspective has been a little narrowed, or, and it has been, the path has been created by the pharmaceutical industry, and we are moving in that direction.
Which is why you told me when we first spoke, I asked you, so what is your ambition ultimately? And you told me you wanted to create a functional medicine center or whatever, which would comprise, I forget, a yoga teacher, a health professional, but with a medical background, maybe massage therapist, a physiotherapist, and then of course maybe a surgeon or a doctor in order to address all these issues.
Yeah. So, like I said, the 4 pillars of health. If we address that, we can, make a radical change in chronic diseases. So for that, it is we need a teamwork. It's just not a practitioner or a one person looking at the patient. The patient needs to be educated about how to. It's not, see, we can give a prescription, with dietary prescription, and say you eat this and that's all, but that's not sustainable. He'll get fed up of that change. So we need to educate. The dietary and the food education has to become part of the hospital, and we need to train people how to make to take decisions when they go for shopping, to learn the way the cook, the grilling, the kind of when you grill, you have so much of inflammatory substances which causes change in the blood stream, also increases it causes it's a risk factor for developing coronary artery disease, atherosclerosis. So so it's fundamental things which we
really
need to
fundamental,
and we need to make the nutritionist, the health coach, part of the treatment protocol in all chronic diseases. And also the yoga therapist and an exercise physiologist should become a part of the healthcare ecosystem.
Yeah, it's like you say. I mean, it's a beautiful thing. It's teamwork. It's a team effort that needs to go into it. I mean, I see it as a sort of three-step engagement, and one is a cooperative element. There's a blend of different inputs. As you say, there's something about education. There's obviously the dietary, and then something about your activity levels. And these are the basic things. You mentioned yoga, but it's taking the stairs instead of the elevator. It's going for a daily walk. All these simplistic things, which also exposes your skin to some of these and other parts of your body, to the mouth, to all these germs that we need to be exposed to. It's physical as well, and then dietary. So those three factors. So the gut. I don't know. Actually, I remember last time at this point when you were telling me this, I sort of threw up my hands and exclaimed, "But why on earth is this not being taught at school?" I mean, there are so many subjects that the minute you take the exam, you've forgotten all about it and it serves you no purpose later in life. Whereas this is absolutely essential for your well-being, for your functioning, for your survival, for your health. I mean, as far as I'm concerned, these are far more important than, I still think we should be taught algebra. And I was pretty good at it, and I'm glad I did it, and so on and so forth. But maybe this should be incorporated in a much more fundamental level into people's education, and certainly at med school.
Yeah, when you say about schools, I remember reading about American schools where they serve pizza, burger, and fries for lunch in schools. So that's really, I cannot imagine, the children being fed, and we are feeding the epidemic of chronic diseases. Of course, America has the highest number of, the ratio and the incidence of chronic diseases is one of the highest in America. And this may be the reason also, because of it's called the standard American diet, which is it's all fries and pizzas and burgers and cheese, and it's really very disheartening to see that happening in schools.
But I mean, this is where things become, obviously there's societal and cultural and conventions and so on and so forth, but there's also the whole way we frame things. So, I think language and conceptualizations matter hugely. And I know we're going to talk about also the mental aspect of these things, both the current state in the world as well as the part that it plays in health. But just before that, I remember going back again to my university days. Jamie Oliver introduced or wanted to introduce healthy eating and awareness of food at the schools. And initially, he was, he was maligned, and people were laughing at him and saying this is ridiculous and idiotic. And it's so bizarre that we have these attitudes. And then the last thing I want to mention in that regard is this division, again, in our conceptualizations of things, between hard and soft science. And hard science is better. Hierarchically, in our estimations, we for some bizarre reason rank hard science higher, and we consider all the things that you've just told us about with all the evidence behind it. That's soft science, and not really taking all that seriously. So this is really like a paradigm shift that needs to take place, but that I think is happening. Would you agree?
Yeah, definitely. I think in terms of the way we are, the information is being accessible now so easily, and that if you look at the positive aspects, I was able to get hold of all this information, although I don't have access to all this, whatever I told you, in any of my medical books, or I don't have anybody in India around me talking about all this. Of course, if you look at Ayurveda, it's always been that the same thing. We are just talking Ayurveda in English now. So, but still, has the people like you and me interested in soft science have more opportunity now. And I think, the information and education being accessible will really shift the perspectives and accessibility also.
Yeah, I agree. I mean, just to go back on the gut as the second brain. I mean, this is a big phenomena that's growing in awareness. I mean, I think I mentioned one of the times that we spoke about how many of the top coaches amongst the extreme athletes. So, I do CrossFit myself and used to do lots of kickboxing and so on. And coaches within those sort of extreme sports fields, they are now paying much more attention to both the state of the mind. Interestingly, I mean, they all advocate meditation. And I know you've done some writing on mantra chanting and meditation. So I want to hear about that in a bit. But going back to the gut, the importance of that, not just feeding yourself lots of probiotics, but finding nutritionally, not just in terms of the energy that you need, but how it works at the metabolic side of the health and stimulates the immune system and so on. And at that point, you mentioned the vagus nerve. So talk to us just briefly about that and the function that it has.
Yeah, we have something called the autonomic nervous system, which is responsible for all the involuntary things we do, like the heartbeats, and we breathe, and digestion happens, and
all the magic that happens without us having to think about it.
Yeah,
the miracle.
Yeah. So in autonomic nervous system, we have something called sympathetic nervous system, which is the flight or fight response which we have when we are stressed. Our stress hormone is secreted by the sympathetic nervous system, the cortisol. And when we sweat and our adrenergic response, all that is part of the sympathetic nervous system. The opposite effect is the parasympathetic nervous system, which calms the body, which reduces the heart rate, which calms our gut also. So one of the nerve is in the parasympathetic is the vagus nerve, which is also responsible for controlling the gut activity, all the digestion and So what we thought was the vagus nerve was predominantly carrying signals from the brain and supplying to the gut, and the brain is controlling the gut and the digestion, and that's what we thought. But the recent research shows that the vagus nerve is actually carrying more signals from the gut to the brain. So when we say our gut feeling, it's actually true in terms of the neurobiology also. We actually are, and also we have a hormone called serotonin, which is a feel-good hormone.
Yeah.
And 80% of serotonin is secreted in the gut.
Yeah, it's something like 2/3 to 80%. Yeah.
Yeah, 2/3 to 80% is secreted in the gut.
Yeah.
So that's how important the gut health is. And when we only look at the macro level, like you mentioned, the athletes were initially looking only at the protein and carb intake and concentrating on the processed food. So when you look at endurance sport itself, cross fitness for a long time or endurance, training for Ironman, so that itself will put you into a chronic inflammatory state.
Yeah.
It's a low grade inflammation which is happening because the stress you're creating in the body is for a longer duration, which has crossed the threshold what you can handle. So there is a low grade chronic inflammation happening in the body. And when you couple it with the processed food which you put in terms of the processed proteins and which are difficult to digest, that increases the inflammation in the gut. So that will, like I said, the 2/3 of the immune cells are in the gut. So the immune cells start reacting to the inflammation happening in the gut. So what happens, the gut lining has a particular threshold. It cannot absorb particles of any size. But when the lining of the gut starts getting inflamed, it starts getting more permeable to larger molecules. So these larger molecules are not optimally digested inside the tract and they get into the bloodstream. Yeah. And these molecules are looked at as foreign bodies from your immune system. Yeah. And the immune system develops antibodies against these foreign bodies, and they form antigen antibody complexes, which then propagate the autoimmune problems. So you might not experience any gut problem as such. It can just be vague bloating, but you might be getting migraines. You might be getting some skin lesions like psoriasis. You might be getting knee pain. And the knee pain may not be musculoskeletal. It may be, the joints are getting, there is autoantibody antibody complexes sitting in the joints causing arthritis. So it can, so everything.
So these are actually caused by inflammation derived from gut dysfunction, if you like. So even in the pursuit and thinking that you are doing something good, you're exercising to the extreme, albeit. But even thinking that you're eating the right food because it's processed and thereby hard to digest and absorb, you end up causing these things, which can have all sorts of ramifications and effects that you think are entirely unrelated. As you said, you've got knee pain, you think you've got an issue in the knee.
That's true.
Skeletal or muscular, okay, so we know it's a multi-factor thing. We know that there is a lifestyle and cultural element to this. And we know what we have to move towards is a new paradigm. And it's one where we have to kind of take responsibility ourselves, but there is also obviously a support dimension to it. We need others to make it sustainable and to make it enduring. But I just want to go back to the interplay of these nutrients and so on, because last time you mentioned melatonin, glutathione, I think, as well, and how these things play a part. So things that you would normally not consider nutrients or supplements, but play an important part. How do we obtain these, and how do we ensure that we are properly fed these things? And can you overdo it just like you can with processed food and so on?
Yeah. I'm sorry, I'll just close the door. This question, we can start off with my answer, right?
Sure.
So when in functional medicine, we look at healing the gut has, to make it very simple, we need to remove all the factors which are causing inflammation, like the processed food, excess carbs, and also any impending infection in the gut. So once we remove that, we have to re-inoculate good microbiome.
Right.
So that doesn't have to be with drugs. That can be your fermented food. It can, like the yogurt has fermented probiotic bacteria. So each cuisine has its own fermented foods. So you start re-inoculating the bacteria, and you maintain the health of your microbiome by having a lot of phytonutrients. The fiber and the phytonutrients in the plants will maintain the health of your microbiome. And then we can also repair the gut lining. So when it comes to repairing the gut lining, we use these supplements which you were mentioning, like L-glutamine. So these nutrients will improve the mucosal lining of the gut. So definitely this should not be a part of your regular routine, like a constant, like you pop a daily multivitamin, you don't have to pop this. It has to be planned and structured in a way which, and personalized according to what problems the person is facing.
Right.
And then you rebalance the whole gut and microbiome by completely reducing the stress, having the mindfulness practices, meditation, and breathing practices. So all these practices will really reduce the sympathetic part of the autonomic nervous system, increase the parasympathetic activity of the nervous system, and that will improve the gut health.
And there's plenty of actual journal approved and evidence-based research that, I mean, this is where previously I mentioned, you'd written something on mantra chanting and so on. I mean, this has a proven effect on your nervous system, calming it, which in turn has a reciprocal effect on your stress levels, which itself has implications in a positive regard on cortisol levels, inflammation, and so on and so forth. Have I understood that correctly?
Yeah, what you were mentioning, the post I had written was looking at the heart rate variability.
Yeah.
So heart rate variability is fairly a new concept, and it measures the parasympathetic and the sympathetic activity of the body. So it's not very now even your iPhone, Apple Watch can tell you about your heart rate variability. There are so many wearable devices which measure your pulse, which can also measure your heart rate variability. So that can be a simple marker for you to know how much of an impact the stress is having and how much you're responding. So we need evidence to say that the mantras are helping or some meditation is helping. So this can be a marker to actually measure. The higher your heart rate variability, the better your parasympathetic system is working. So
yeah, because sorry to interrupt there, because it's very important. The heart rate variability is proven to be one of the best indicators of the likelihood or imminence of, say, a heart attack, right?
Yeah, it can predict the risk of having stroke or cardiovascular diseases when you have lower heart rate variability. So that's a wonderful tool for which we can use to measure and really prove that all these elements which are improving our lifestyle and also improving the balance in our body is actually helping us recover from diseases and treat diseases also.
It's I mean, now that we are talking about stress and inflammation, let's just stay on this topic, because I was speaking, having a similar conversation like we are today for another broadcast with a theologian, and we were talking about the mental state, obviously initially or primarily in terms of faith and belief and so on, and the role that religion plays in her life, and why she thinks that's meaningful, but also the mental state of especially young people today, and particularly in reference to the lockdowns and the fear that people are walking around with, and these things play a very real factor. So in the process of what we think is providing a temporary solution to a problem, we are actually generating a pretty profound future one. And I mean, I know you've read, studied, and written about stress and inflammation. So maybe we can just talk about what kinds of stresses that occur, and why it's important to be aware of those.
Yeah, this actually, there is a lot of evidence now to show that the social interaction, regular social interaction itself can really reduce the inflammation. So that itself is being, foregone in this times of COVID and lockdown. So, of course, we can always use this kind of a video chat and social networking, but the impact it is having on teenagers is radical. We are not able to have the kind of input they're having from social media, and also we are removing the social interaction from their life. They're not able to go to the playground, and they're not able to interact with people.
Not that teenagers go to the playground a lot, but other places. But I get your point.
So yeah, so there's definitely enough evidence now that the social interaction can cause increased dopamine, serotonin hormones, which will have a positive impact on the brain and also reduce the inflammation and stress level.
Yeah. And this is why we keep coming back to, the holistic approach, the multifactorial, your functional approach to things. And that's where, again, I throw up my hand jubilantly to a phrase that you used a lot, and you haven't used it so far. So I'm going to make sure it's mentioned, and it's the catchphrase that I associate with you, which is from illness to wellness, in all the different aspects. I think we've been going on for a long time, and we need to keep material for the other sessions as well. So maybe we should finish it here on that note, from illness to wellness, which I think you've provided a fantastic explanation for, from a biological to a societal one. I think it's so important. And to hear it from someone who is an accredited expert in the traditional one, it makes all these things that you're saying so much more persuasive. I think people are more receptive, even if they already know it. I mean, if something is important, we need to hear it many, many times. And that's why I think I want to thank you, and we're going to provide links to your LinkedIn and so on, so people can follow what you're writing, because you're continuously writing about findings that you come across.
Yeah, so like you mentioned, to prevent this epidemic of chronic diseases, we have to look beyond illness, and we have to move from just treating diseases to optimizing the body's physiology. So that's why I said we have to shift our focus from just treating illness to aiming to achieve wellness, to just being fine from patient goes back home from the hospital with just being fine, but patient has to go back feeling fantastic.
Yeah.
So we need to really focus on treating the root cause and completely reversing chronic diseases and aiming for wellness and having a fantastic life. So that's my final agenda.
That's fantastic. So let that be the starting shot that launches a societal and cultural change in that direction. And with that, I want to thank you from certainly from my point of view, and I'm sure also from all the listeners and viewers. Thank you so much, Kasper, for giving me this opportunity to be a part of your noble initiative. It's been an absolute pleasure.